Joining me now is House Majority Whip Jim Clyburn of South Carolina. He's the third-ranking Democrat in the House of Representatives, and he serves on the Congressional Black Caucus. And he's been a good friend to me in these conversations. Whip Clyburn, let me just start out. I usually don't call out our sponsors on these events, but the sponsor for this is called Consumers for Quality Care. Now, we can call these patients for quality care. We can call it human beings for quality care. And we're sort of looking not just at the economics, but the life dimensions of, a lot of folks have coverage and they're still sinking in debt. A lot of folks don't have coverage. And I want to ask you a political question. What are the political consequences of not actually making real traction in getting this health picture in the country more correct? You're muted, Congressman.
Thank you very much for having me, and I apologize for coming on a little late.
You're always right on time.
Thank you. I don't know that I see any real serious political consequences beyond of a partisan nature. I think that these consequences flow pretty evenly across the board when we fail to solve these problems. I listen very intently when I hear people talk about the failures of certain things that we do and not focus on the successes of them. Now, I noticed a pretty extensive discussion about diabetes. My late wife died from diabetes, 25 years. She struggled with the disease, and I saw what it did to her physically and never thought about it politically until such time as I saw her bill for insulin, which ran from $800 to $1,200 a month. And then I started doing research and found out how long insulin has been around. And the cost of making the insulin and how much money could be made by the companies if the insulin was capped at $35 a month. So why was her insulin costing $800 and $1,200 a month? That's where the politics kick in. And so, the political consequences, I don't think are of a partisan nature. It's across the board because everybody here, Democrats and Republicans, independents, everybody here have got to ante up the cost of insulin when politically it should not be costing that much. So,
it's not always, the powerful in this, but, I've interviewed in the past our mutual friend Peter Welch, and Peter Welch's late wife, who suffered from cancer, also covered by health insurance, yet staggering costs for various parts of the drugs that she had. And this picture is, just sort of felt across America. Absolutely. in every walk of life. The question is, Congressman, do you have a sense of a roadmap that we need to begin thinking differently about? I'm just wondering, after having done so many healthcare events on access and affordability and Medicaid, and I know you're angry, about those 12 states that are out there that have, left 2 million people uncovered by Medicaid out there. I just want to know if there's a compelling roadmap that can help us change the conversation from your perspective.
I don't know if it will change, being from South Carolina, one of those 12 states, and knowing the history of the country and how regional this problem has been, then I know that the failure to expand Medicaid, basically in those states that have traditionally locked certain aspects of our great country away from certain people. And that I know. And so when you hear me arguing about expanding Medicaid, or in some way, those people who are eligible for Medicaid expansion, asking the federal government to step into the picture and hopefully create another aspect of the Affordable Care Act Because remember, when we did the Affordable Care Act, we thought we were taking care of all of these matters. Then all of a sudden, we get this decision from the Supreme Court, which kind of laid out a different roadmap for us. And so what we have not been able to do is to make the Affordable Care Act fit the decision of the Supreme Court when it left it up to the states to do certain things that we had hoped we were doing at the federal level, and would not subject state people who live in certain states to certain states' rights consequences, which is exactly what it is. You leaving it up to the state whether or not these people of low income who cannot afford certain things, whether or not they get medical attention or not. That's what this decision was all about. So no matter how you cut that Supreme Court decision determining that the Affordable Care Act was in fact constitutional, but it put in that opt-out for states that made it impossible for too many people. That's why I say the politics of it isn't necessarily partisan. The politics is those who have shall get, and those who don't will not.
I mean, this is why you've been out there, I think, very bluntly saying that we have to look at healthcare as a right and change that opt-in and opt-out dimension of it, which I understand. Let me ask you another dimension of this. And again, I'm asking you these big meta questions, and not in a Facebook sense, but like really meta, not the company. But one of the really distressing things that we've all learned as a result of 2 years of COVID, looked at mortality, looked at the level of impact, is that race was a dividing line in terms of outcomes and the experience. Race was a huge issue, particularly early in the pandemic. If you look at diabetes, if you look at rare diseases, if you look at all sorts of other chronic diseases, those patterns are pretty much exactly the same, where there's a disproportionate burden and impact that's based on, at least correlates with race. And I've done zillions of interviews now, and I understand there's an absence of trust, of connectivity, of people seeing folks in the healthcare system that look like themselves. But I'm just interested, you've struggled with this for so many decades. Is there anything that we can really begin doing that we're not doing now to elevate that dimension so that we can make health, at least the healthcare that we have, one that is absorbed in an egalitarian basis in this country?
Well, I noticed the congressman before me talked about getting beyond maintenance to cure. I would start before maintenance and see whether or not there is more that we can do on the prevention side of all of this. Now, we may not know what's caused something like diabetes and that sort of thing, but there are a lot of things on the prevention side that if we were to invest in, it seems to me it would solve some of these problems because they will prevent these problems from ever taking place in a certain place. The environmental issues are very, very important. I remember being at a research institution down in New Mexico several years ago when I was told that life expectancy in this country got beyond 50 in the last generation to where it is now, in large measure because of the water that we drink. If we clean up the water so that people have safe drinking water, we clean up the air so that people will not be breathing polluted air. If we look at the way where we locate certain production facilities and that we know may be causing ill health, maybe asthma in some communities, cancer in other communities. These kind of preventive measures, if we were to do a better job of that, I think that in and of itself would bring healthcare costs down, and it would keep people healthier longer, and they would live a better quality of life. So the prevention stuff, I just don't think that we spend enough time taking a look at what will prevent some of these things from taking place in the first place.
Thank you. Do you think President Biden and his team have a good plan on addressing the cost and debt problems of healthcare? Another thing I learned today, I just didn't know it. Basically, you got almost a quarter of Americans with pretty staggering debt that's health related, and these are Americans that are covered by health insurance. And so that's before you get the broad cost of all the stuff you show up at the hospital for next time, but it's the stuff you've already got out there. And I'm just wondering, this is not something I've seen in the headlines. It's not, a topic that I see us having a kind of a daily communication about in this country. Is the Biden team doing enough on it?
Well, I don't think anybody's doing enough. The Biden team has inherited, he's only been there, a year and a half now?
Time flies.
Nobody did enough before him or before the person before him. We have not done enough in this area, and we should do more. As developed as we are as a nation, why is it that we lag so far behind the nation just north of us when it comes to health care and its delivery? No, we have not done enough, and we will ever do enough. I don't know. It requires a will that we have not developed in this country to say we are going to do something about this, and we will not let the profit motive keep us from doing it. No, we aren't doing enough.
Let me ask you finally a question before, and then we have a quick question from the audience for you, Congressman. I guess during the Obama administration, I interviewed the Surgeon General, who is Vivek Murthy, and he's back as Surgeon General now in the Biden administration. We talked about the loneliness epidemic in the country. We talked about the mental health epidemic in the country. And we talked about the gun and violence arena as public health issues and public health failures. And so he wrapped all these issues into a health formula. And it made me think back then, particularly on the mental health front, where the economics of supporting mental health, even under the Affordable Care Act, even under programs that go towards wellness rather than fee for service, of whether or not we really have adopted conceptually a holistic picture of human health and what it means and community health. And I love the picture. I wonder how we get there.
I wonder about it too. And I do believe that this whole gun violence thing is a problem. It may be mental health in some instances, but once again, it is physical health in other instances. And it's what happens in almost any place in America when you go to emergency rooms and see the proliferation of gunshot wounds and that kind of stuff growing out of a permissiveness that exists and our refusal to be more prevention oriented. And we know from our own experiences in the past what is required to lessen some of these occurrences, but we're not doing it because once again, the profit motive overwhelms us when it comes to curtailing the presence of guns on the streets of America and doing other things that are necessary to lessen the proliferation of these weapons of war. And we see what's going on. Someone called yesterday and said, maybe it's time for us to have an Emmett Till moment. Now, I know what that meant, because I know what Emmett Till's open coffin did, even to my own youngest daughter when she saw that. And people are now saying, we just need to see the results. Even what happened in Uvalde, the stuff that happened there, we have not seen it. We've heard about it, and we are not in touch with it because we haven't seen it. I don't know what it's going to take. I do know this, that there is a will that must be developed if we are going to do anything about these things. Martin Luther King Jr. warned us that the people of ill will was making a much better use of time in this country than the people of goodwill. So the people of goodwill have got to make a much better use of their time to say, what can we do to prevent these occurrences? Stop the violence, stop the absence of health care, do the things that are necessary to improve the quality of life for everybody.
Well, there's a lot you said that's so wise today. I'm going to make sure our team just tweets out what you just said. Martin Luther King's words, very, very important. We have a question for you, sir, from Susan Weinstein, who's the co-executive director of Families for Depression Awareness. She says, in mental health, we face a variety of challenges in accessing care, including but not limited to an inadequate number of practitioners and even fewer who meet the demand for culturally appropriate care. Worse, though, is the number of clinicians, especially psychiatrists, who don't accept insurance at all. Are there any federal policy options for addressing this problem, or would it all have to be handled at the state level, such as by making participation in insurance or paying a substantial waiver fee a requirement of professional licensure? So detailed question, but it really is, what do we do about these other gaps of getting folks covered and treated?
She hits the nail on the head. That's what the issue is now. State by state by state by state. We are all Americans. My late friend John Lewis used to say all the time, we may have come over here in different shifts, but we're all in the same boat now. And we may have gotten to these problems in different ways. But to solve these problems, we need a national solution. I should not be able to go to North Carolina and get much better care than I'll get in South Carolina on these kinds of issues. When it comes to mental health issues, when we come to all these other things, there needs to be a comprehensive national approach to solving these problems. People should not be able to forum shop when they're looking for justice, and they ought not be able to go from hospital to hospital to get a quality of health care.
Well, Majority Whip Jim Clyburn, I always love our conversations. I mean, there are some tough ones, but I really appreciate your candor and your thoughtfulness about these. Thanks so much for joining us today.
Well, thank you very much for having me.